Good afternoon and thanks for joining us. I'm Judy Simpson. The image of an older adult fallen on the ground and calling for help is etched into our collective subconscious, partly because of commercials on TV and partly because we all know an older adult who's fallen. Sometimes a fall can be life-altering. Today we have three professionals with us, a nurse and two physical therapists. They work with older adults and they will tell us about a national effort to help prevent falls. Let me introduce Diane Wheaton, who is a registered nurse with Fletcher Allen's Falls Prevention Clinic, along with Ashley Payne and Maggie Holt, who are both physical therapists at Fletcher Allen. I want to thank you all for being here today.
Oh, thank you.
Now, Ashley, it seems like falls are more common with older folks. Why is that?
Well, you see, as we age, or I don't actually have to tell any older adult that as we age, our body changes. Okay, so you notice visual changes often, but in the same way, all of our senses actually diminish. Okay, and in combination with if we don't move as much, we lose strength, we lose flexibility. So basically, all of these smaller changes can lead to one big problem.
And how significant is the problem?
It's a big problem. In fact, 1 out of 3 older adults will fall in any given year.
Really?
Right.
That's amazing. So what else happens from a fall?
And 1 out of 10 of those will result in a serious injury, such as a hip fracture. And also, you know, even if there isn't an injury that occurs with a fall, some bad things do happen. In fact, if you've fallen before, you may be scared that you're going to fall again. And unfortunately, that may mean that you're less active, more sedentary, and then you lose some strength and you're not moving as much, and unfortunately, your risk for falling increases again. And
So it's really a cycle.
It is a cycle that just it's a cycle of disuse.
So Maggie, what do we know about what causes a person to fall?
Well, really, to understand what causes a person to fall, you have to understand how somebody keeps their balance in the first place. You know, it's really a big task to keep a body upright when there's gravity all around. If there was one organ to focus on, it would be easier to prevent falls. But really, it's a combination of many different organs, many different senses. You need at least 3 different senses to keep your balance. An interplay between your vision, so you can see the environment, your inner ear, which acts like a gyroscope, and sensation from the ground that you feel through your feet and your legs. Those have to interact through the nervous system and then put out a response through the muscles and the joints that's strong and powerful and flexible so that you can stay upright even if you get, you know, knocked off balance.
And there are other things as well, Diane, right?
Yes, yes. It's important for our muscles to get sufficient nutrients. So if you think about your lungs and taking a nice deep breath, you're getting in the oxygen, which circulates into your blood through your heart, which works like a pump and pumps all that oxygen and needed nutrients from your blood system to your muscles. And that gives you strength. And you also need an adequate oxygen supply in your brain so that you can think clearly, and if you should start to tip over, you want to be able to react quick enough to prevent that fall.
And so, Ashley, why do falls affect older people in particular?
Well, as I was mentioning before, our body changes over time, and it's all of these changes that have an additive effect interact together, and that's why our risk is greater as we grow older.
And so, Diane, is there something that a person can do to prevent falls?
Well, a person can work on reducing their fall risk, and that will reduce their risk of falling. There are individual risk factors, such as making sure you're taking the right medications, making sure you're adequately hydrated so that your blood pressure won't go too low, which can make you dizzy. And then there are environmental factors, such as a pothole in the sidewalk, or if it's snowing out, to make sure that you wear snow boots. That's very important.
Yeah.
Boy, these things really add up.
Yeah, and it's really that whole notion of risk factors is really the good news. You know, there's been a lot of studies on what causes fall and how to prevent falls. And over the years, we haven't been able to come up with one formula, this will prevent all falls, but we have been able to see that trend in the literature. So the CDC has put out, CDC is Centers for Disease Control. They've kind of drawn out some of the major risk factors that people can control. And fall prevention revolves around mitigating each one of those risk factors, trying to meet them head on. So it was just last year that Center for Disease Control put out this toolkit to help caregivers like us, like primary caregivers, anybody who sees older adults, to help manage those individual risk factors, even when they're in the primary care office.
And so, Ashley, can you tell me a little bit more about the toolkit?
Sure, the toolkit is called the Steady, and one part of it is actually a simple 12-question self-test. And this is great because you can actually get this at home on the internet, on the CDC website, or you can fill it out on your own and add up the points. Okay, so for a person who scores 4 or more points, that does show an increased risk for falls. But this is great because you can take this in to your doctor and get a discussion started about what the two of you can do together and come up with a plan.
What are some of the questions? Just a couple of examples, perhaps.
Yeah. They're right there on the screen, and some of them are about your vision, whether you have good enough vision. Some are about if you have to rush to go to the bathroom enough, because that can be a risk factor for falls. If you've fallen before, because those are all significant risk factors for falling.
And Diane, you should really involve your caretaker with this too.
Absolutely. Your doctor can help you to manage your risk factors, go over your medications with you, and to help you with all of those things. And there is a checklist, a home safety checklist, which is a good resource to use for people to check around their houses for things like scatter rugs that might move and things like that, things that you might not think of. And your doctor can refer you to an occupational therapist. And what that person does is they look at what we call activities of daily living. What are the things we do from the time we get up in the morning until we go to bed at night? From dressing to taking a shower. So one of the things the occupational therapist may recommend is to put a grab bar in the shower so that you don't slip and hurt yourself.
Well, those are pretty simple solutions that you probably wouldn't think of.
Yes, absolutely.
Right. And the part of the study is also 3 activity-based tests, and this is what gets physical therapists like Ashley and I kind of excited, because it helps an older adult really take an honest look at what their strength and their balance is like. So today we have an older adult that's come with us to help us demonstrate these tests.
Okay, excellent.
Good. So meet Jane McGrath. Jane took an honest look at her balance a couple of years ago. And decided to start an exercise program.
So we're going to be doing some of these activity-based tests. I know that you're no stranger to them. Could you just tell us a little bit about how you got started with your individual exercise program?
Well, there was a convention for physical therapists in Boston 2 years ago, and I went to it, and they had a special program for seniors on balance and exercise. And I'd had a lot of low back pain, and they recommended that I get into an exercise program. So I signed up at a local hospital, had an excellent experience. In 3 sessions, but the back pain went, and I've never had it back.
Wow.
So I still try to exercise.
Great. And hopefully it's helping you feel more safe and steady.
Yes, it is.
Great.
It's very helpful.
Wonderful. So I'll actually have you take a seat here, Jane. And we're going to get started with the first of the activity-based tests. It's called the Timed Up and Go, and it just takes a look at your efficiency when you move. Okay, so what I will have you do when I say go, you're going to stand up, you're going to walk over here to this line, turn around, walk at your usual pace, back to the chair, and sit down. Okay?
Okay.
Ready? Go.
Nice. Good. So it's not so much about how fast you walk, but how efficiently you walk, right?
Right.
Okay, and sit back down. Great. Okay, so that was 22 seconds. And for someone who takes 12 or more seconds on this test, that does show an increased risk for falls. But this is really good information to have because it actually shows that you could be someone who would benefit from using a cane or an assistive device like a cane or a walker. And do you do that?
Yes, I use a cane.
Oh, wonderful. So that helps reduce your risk.
Keep it up.
Great. That's great.
Good. Okay, so it's my turn. Jane, I'm going to do a balance test with you. So come on and stand up. This is called the 4-stage balance test. So I'm going to have you put your feet into 4 progressively harder positions and keep your balance for 10 seconds in each one. So start, I'm going to hold your hand for the beginning of each one. Bring your feet together, heels and toes touching, and when I let go, hold it there for 10. Ready? Go. So this position is a little bit harder than normal, but it's not too bad. I can see your balance system working a little bit harder, but you're maintaining very well. Nice job. Good. That's 10 seconds. Relax. Bring your feet apart, and I'll show you the next position. It's with one foot halfway in front of the other. One heel touching the instep of the other one. Good. So catch your balance, and when I let go, hold it for 10. Go. Nice job. So, you know, each position has more demands on your balance, so it prepares you for everyday life when you have to walk between furniture and things. Good. 10 seconds. Relax. Come back. Good. So you can see this is hard. I don't want people trying this at home in the middle of your living room floor. It's tricky. The third position is even harder. One foot directly in front of the other. Good. Very good. Once you get squared away, good. I'll hold it for 10. Whoop. Hold on there. Good. I know. A little nervous. I understand. Good. 5, 4, 3, 2, 1. Good. Relax. Come on back. That was good.
Yeah.
So 3. Last position is the hardest. Give it a try. It's going to be hard. I know. It's 1 foot. So I'm going to hold your hand. You stand on 1 foot. Let go. I'll count 1, 2, 3, 4, 5, 6, 7, 8, 9.5. Good job.
That's
Great. Good. Have a seat. That was really good. Good. And I know you've been working on those things, so that's good. So these are assessment tools, are tests, but they also kind of spread into a home exercise program. Carefully at your kitchen counter, right?
Yes.
Good. The last of the activity-based tests is a really practical measure of your strength, because there's such a strong correlation between strength and falls. I simply want you to sit in the middle of the chair. I want you to cross your hands in front of your chest and rise up to standing without using your hands, okay? That's your practice one right there. Go ahead back down, because I'm going to time you. When I say go, you'll do that over and over, and I'll count the repetitions. Ready? Go. 1. Good. It's a 30 seconds chair rise test. 2. Good. 3. Nice job. Good. 4. Good. You can feel those muscles working, can't you? 5. And everybody's had that experience where they can't get up and out of the chair. 6. Sometimes it's because you're weak. Sometimes it's because the chair's low. 7. You're doing great.
Nice
A
job.
few more. 8. Good. Then 9. Holy mackerel. Nice. 10. Good. You did 10 repetitions, which is really good. So
She should keep going.
we've got, you can see on the slide, there's age-related norms. You can relax your arms. And we match you up to your age group. You're in the age group where 8 for women would be an average number of repetitions, and you exceeded that. Nice job.
Thank you.
I'm working on it.
So that's a good statement about your strength, overall strength. So now you know you have to work on that steadiness, which you've been doing, and that, and use your cane. But strength-wise, you seem to be doing well. Keep it up. That's the main thing.
Jane, thanks so much for coming in and showing us your stuff.
Yeah, really. Thanks a lot.
Thanks for help.
Is it helpful? I'm going to help you over to across the stage. Thanks for coming.
So actually, people can reduce the risks of falling.
Well,
Nice if I
that's the great
fell on
part
the
about
heat.
this. In the 1950s, 60s, and 70s, it was pretty much accepted as a fact of life that as people grew older, they became weaker, and it was thought that falls were inevitable. But luckily, with research starting in the 1990s, we've realized that throughout every decade of life, you can actually improve muscle function. So that's the great news. It's not inevitable, and if we keep moving, we can reduce our risk for falls.
And Diane, what resources are there in Vermont to help a person stay active and avoid falls?
Well, for those that live in and around Chittenden County, there's Fletcher Allen Healthcare, and we have a fall prevention clinic, which is where I work. And there's the Champlain Valley Area Agency on Aging, and they have a senior helpline that I believe those numbers are right on the screen. And there's a new fall coalition that's the initiative of the National Council on Aging, and they have many, many resources on their website too. And if you live in an area in Vermont that is not in Chittenden County, then your area has its own area agency on aging. And if you don't have the access of a computer, you can call the 1-800 number, the senior helpline, and they can help you from that number.
And actually, there are exercise classes as well?
There are. Actually, this Champlain Valley Agency on Aging has some evidence-based group exercise programs, which for a lot of people are very helpful because it adds a social component to your exercise. But if there are barriers to you getting exercise, that's when Maggie and I, physical therapists like us, can really help. Because we understand age-related medical issues like arthritis and vertigo, heart and lung
back
issues.
pain that Jane was
Exactly,
having,
just
right?
like Jane had. I mean, we can really help you come up with a plan that's safe but also going to work for you.
Okay, and quickly, Diane, what do you want our viewers to be sure to take away from what you've shown us this afternoon?
Well, there are 4 things that you can do to prevent falls.
Okay, the first would be get a home safety checklist, work to make your home as safe as you can.
Make sure you have an up-to-date eye exam because eyes are so important.
Know your medications.
And then lastly would be stay or maintain or start an exercise program so you can
Stay strong and stay steady.
Ladies, thank you so much. This was really great and a lot of good information. And if you have any questions, you can contact the Vermont chapter of the American Physical Therapy Association. The phone number is 802-230-4686. You can also email, and the address is office.vtapta@gmail.com. Thanks again for coming in.
Thanks
for having us.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.